Nagbibigay sa amin ng lakas at inspirasyon upang mas maprotektahan ang mga manggagawang Pilipino. Ito pong webinar na ito ay panimula lamang sa nakalinyang webinars ngayong buwan ng Nobyembre. Nilalayon po namin na magbigay ng dagdag kaalaman at impormasyon sa mga bago at naaayon na issuances na may kinalaman sa occupational safety and health. Gayon din, kung paano ipapatupad ang mga ito sa ating mga lugar pagawaan. Sa pamamagitan po ng ganitong mga platform, nagagawa naming maabot ang mas nakararaming mga individual para maging katuwang namin sa pagpapalakas ng advokasya ng kaligtasan at kalusugan sa lugar pagawaan. Today's discussion will be about tuberculosis or TB, particularly the updates on workplace TB regulations. In the Philippines, about 70 Filipinos die daily from this disease, and this makes us the fourth largest contributor of TB cases globally. TB is not new to us. We have been fighting this contagious disease for so long. There are a lot of drugs developed against these illnesses, but the virus also continuously evolve to adapt. Therefore, we also need to update ourselves with new strategies, preventive care, and response, especially in the workplace. Since employees spend most of their time at work, it is vital to tackle TB in the workplace. Today, we have invited subject matter experts to discuss the following: global and local TB situation and current national initiatives, supplemental guidelines on the implementation of safety and health measures for the prevention of and control of TB in the workplace, PhilHealth packages for workers with TB, and e-learning modules for capacitating workplaces for learning about TB and reporting cases. So before I end this, I urge all of you to become OSH champions. We admit that advocating OSH is a challenging task, but we are counting on you, our partners, to spread awareness about OSH to promote a stronger, safe, and healthy culture. Muli, maraming salamat sa pagdalo ninyo ngayong araw. Sana ay marami kayong matutunan at sana po ang inyong mga matutunan ay ibahagi ninyo sa ating mga kasamahan sa trabaho. Magandang umaga po sa inyong lahat.
Thank you for that very inspirational message, Sir Jerry, and you have also given us a glimpse of what we will have for this morning. And to continue on what you have said, this would be our program flow. So we're done with the opening ceremonies for this morning and our prayer and welcome remarks by our DED. We will then have the reminders and some webinar house rules. And for our lecture proper, we have first overview of the global and local TB situation and current national initiatives, which will then be supplemented by a lecture from our office, from a personnel from our office on the guidelines on the implementation of safety health measures for the prevention and control of TB. And then we are very fortunate this morning to have a resource person from the agency itself that implements health benefits for TB for workers with TB from PhilHealth, who will discuss consulta packages for workers with TB. And lastly, we'll hear the presentation of Employers Confederation of the Philippines on their e-learning platform with the #WorkTB-free. So some reminders for our Zoom webinar this morning. Kindly rename your Zoom names to this format, agency-your name. And we ask everyone to please keep your microphones in mute mode and reserve your questions on our allotted Q&A portion. And certificates and a copy of presentation will be emailed to you once you have completed our evaluation form. So no evaluation form, no certificate, and it will only be until 2 p.m. And one more thing, we also appeal to you to refrain from posting your sensitive personal information in our comment section and in our Zoom chat box, especially like your email, phone numbers, whole name, your address. So just wait for the evaluation link for the QR code, and that will also serve as your attendance. Please refrain from flooding the chat box and asking from time to time, where is the attendance link, or how can you get the certificates? Kindly wait for the evaluation portion of our webinar. Thank you. So some more reminders via frequently asked questions. This number one, is this webinar is free? Is the webinar free? Yes, this webinar is free. Number two, will there be an electronic certificate? Yes, there will be an electronic certificate sent to you via an email. Why is the registration on Zoom closed already? Can we still join the webinar? We can accommodate only a few slots in our Zoom room because of some technical restrictions. So you can still join us with via Facebook Live, and you can still get your certificates too. Can the unemployed join the webinar? Certainly, everyone is welcome for this webinar. I am watching via Facebook Live. Can I still receive an e-certificate? Yes, you can still receive an e-certificate given you have accomplished our evaluation form. Is there a deadline for the submission of the evaluation form? Yes, there is until 2 p.m. only today, November 7, 2023. Will I be given a copy of the presentation? Your certificate will come with the copy of the presentation of our resource speakers. So much so for reminders. Let us now get to the meat of this morning's webinar. Our first speaker is a Deputy Chief of Party and Private Sector Advisor of USAID TBIHSS Project, FHI 360 Philippines. She is a Fellow of Philippine College of Physicians, Fellow of Philippine College of Chest Physicians, Fellow of American College of Chest Physicians. Here with us to discuss about the global and local tuberculosis situation and current national initiative is Dr. Lalaine L. Mortera. Doc, the Zoom spotlight is now yours. You
Yeah,
may now
thank
share your
you.
screen.
Yeah, thank you, Paul, for the kind introduction. Allow me to share my screen. Oh, the host disabled participant screening sharing. Kindly make me a co-host.
For a while now. Okay.
So it's always a pleasure to be joining OSH webinar series. And thank you for making TB as your topic for this month. So
Yeah.
can I now share my slide?
Um, for a while, Doc. Okay, yeah.
Okay, I hope you can see it in presentation mode.
Yes, Doc, it's clear.
Okay, so the topic that that was assigned to me is about the global and local TB situation. And later, I will be talking about current national initiatives that are relevant to the workplace. Now, this is always my starting slide so that we know where we are going to. So the target really is to end TB by 2035. And this means that it's a world free of TB, zero death, no disease, and no one suffering from TB. And when we say that we have ended TB, at least there should be a reduction of 95% compared to 2015. There should be a 90% reduction in the incidence rate compared to 2015. And there should be no one suffering catastrophic costs due to TB. Now, where are we now? For the past many years, the WHO actually introduced several strategies. So way back in the late 90s to early 20s, they introduced the DOT strategy, which was replaced by the Stop TB strategy, where the private sector is actually invited to participate, and they already started to introduce some initiatives around HIV, TB, and multi-drug resistant TB. Currently, the NTB strategy starts from 2016 to 2035, where we look at more bold policies and supportive systems that should be happening in order to end TB, a more integrated person-centered TB care and prevention, and of course, intensified research and innovation to be able to reduce and have better outcomes. Now, currently, as how we are doing now, if we will not do anything drastic or innovative, the current global trend is a reduction of only 1.5% per year. So if this will be the trend, we will not actually reach the 2035 target. So if you want to bend the curve and increase the reduction by as much as 10% per year by 2025, we have to introduce current and new tools that are emerging from the pipeline. And more importantly, we need to pursue universal health coverage and social protection. And I'm glad that we have a speaker from PhilHealth to talk about universal health coverage and social protection. But if we want to go further and reduce and bend the curve further by additional 5% per additional decline by as much as 17%. We have to be able to introduce the new tools like the vaccine, which I know is not yet out. It's still being developed. And then, of course, coverage for latent TB infection. And more importantly, bringing tests to where patients are, so point of care testing. So this will bend the curve to as high as 17% per year. And if this is the trend that we will follow, yes, we'll be able to end TB by 2035. However, for the past 3 years, we have witnessed that all of our accomplishments have been reversed due to the COVID-19 pandemic. In fact, it is the first time for the past 10 years that we are reporting an increase in TB incidents and deaths. For now, we actually have a incidence that has increased from 2020 to 2021, including mortality among HIV negative and mortality among HIV negative patients. The ranking of the Philippines has not changed. We are still number 4, and we are contributing to 7% of the global burden. The global burden is about 80%, which is contributed by only 8 countries. So we are in the magic 4 of this dreaded list. We've always been here. We've always been part of this list. And sad to say, we used to be part of the high burden country for TB, and then drug resistant TB. And unfortunately, we are now also in the list for TB and HIV. Now, the substantial reduction in TB case notification is definitely due to the COVID-19 pandemic because people were advised to stay at home. They were afraid to go out. And because of that, we are number 4 reporting reduction in notification if we compare this with 2019 and 2021. There are experts who have done modeling studies, and they have said that, and they predicted that by 2025, we do not see any decline but further increase. So the incidence will increase by 130%, and then deaths will be higher by 170%. Now, currently, where are we now? This is based on the WHO Global TB report published last year. Only 321 out of the 741,000 are actually notified, meaning they are diagnosed to have TB and are started on treatment. But we are still missing the 419,000 who are not yet notified, are not yet diagnosed, and may be transmitting the disease in the community, in schools, and in the workplace. Now, why do patients why are patients not diagnosed, or why are missed by the system? Let's go first with health, with the patient-related factors. This is a survey result done in 2016 showing that among Filipinos already have symptoms suggested of TB, like your 2 weeks cough and coughing out blood. Majority will not do anything. So I hope that our listeners this morning do not belong to this population where they do not do anything, even if they already are presenting with symptoms. Unfortunately, 40% also self-medicate and only 19% seek care. And the reasons for this health-seeking behavior are these findings. It's really behavioral. Patients or Filipinos think that the symptoms they have are not significant. Yung tipong, kaya ko pa, kaya pa to ng whatever cough suppressant that you can buy in the pharmacy. So they think the symptoms are not significant and therefore they tend to worsen over time. Some workers or some Filipinos also think that it's expensive to seek care. And they think that time is a constraint. They don't have time because they're busy at work earning livelihood. But this is actually not different from other countries belonging to low to middle income, high burden TB countries. There are a lot of reasons why seeking care is delayed, but it's not only patient related. They may also be health system related. So they know that they have symptoms, but the nearest health facility for TB is probably so far from the workplace. Or it's possible that the doctors who are treating them do not have access to better diagnostic tools or screening modalities. So my talk would focus on how we can address the stigma and establish a supportive, enabling environment. So recently, in the last March World TB Day, this document was launched. It's called PAAP TB. It's the Philippine Acceleration Action Plan for TB, and it cuts across many years, 2023 to 2035. And this document endeavors a multi-sectoral approach to address TB burden and strengthen the health system's capacity to deliver universal health care. Now, this graph would tell us that majority of our Filipinos would not, majority of their lifetime, 20% is spent in accessing health care, be it primary, secondary, or tertiary care. And majority of their life is actually influenced by more factors like your socioeconomic factors at 40%, healthy behaviors 30%, and the environment 10%. Let's talk about environment. We have to pursue these different health care settings framework like healthy communities and surroundings, healthy workplaces, and healthy schools if we want to address TB and NTB. How about healthy behaviors? I think this is very relevant to our workers. There are 7 healthy behaviors that should be promoted at all settings. And in relation to TB, I think moving more and eating right is one of the factors that can help us avoid TB, so that we avoid having diabetes, which is a risk factor to develop TB. Don't smoke, because we know that smoking correlates and is a risk factor for tuberculosis. And of course, practicing safe sex. We have HIV. If we do not practice safe sex, and you know that having HIV is the highest risk factor to develop TB. Socioeconomic factors, education, family social support, job status, income, and community safety. So PAAP actually focuses on key result areas, and the Department of Health would like to focus on supporting service delivery, be it at the primary care, at the secondary or tertiary level. So our colleague from PhilHealth will be discussing about the different benefit package for our patients. For labor, then I think Dr. Jeremias will talk about the commitment of DOLE in terms of PAAP TB. Now let's go back to the drawing board about promoting healthy lifestyle. The Healthy Filipinas campaign. This is actually making sure that Filipinos remain healthy and their settings are healthy and at low risk to develop various diseases. So for this, I would focus on healthy workplaces. Now, there are many digital innovations that are already available. So if you just Google, you can open healthylungs.ph website. This is actually a website where the latest information about tuberculosis, about other diseases can be found that can be used for disseminating proper information to our colleagues in the workplace. There's also the TB-free self-assessment tool. This is actually it's part of the Healthy Lungs PH website, where individuals will be able to assess if they are sick of TB. Then they can go through the self-assessment tool and they'll be guided for the next step, whether they need to see a provider, they need to have an X-ray done, or they can directly go to for the sputum test. Now, for some social media campaigns, these are all available in the Healthy Lungs PH. You can always download them, and for future e-posters, it will be posted in this website. Now, for the community, DSWD actually is very strong in promoting the family development session, where TB awareness has already been integrated. So for our colleagues in the our informal workers who are also recipients of the 4Ps, then they can also participate in these family development sessions, where households are being targeted and are taught about the basic awareness about tuberculosis and where to seek care whenever they have symptoms. There also are barangay and community health workers who have already been trained as health services navigators. So this has been started in selected LGUs, and there is a plan to cascade this nationwide. So for this one, it's promoting not only healthy seeking behavior, but also advising our patients where to go and promoting TB prevention, the use of our preventive treatment to be able to avoid development of TB. Now, there are also some companies or workplaces who have partnered with the Department of Health to make our some of our health centers beautiful looking, because we know that when we have tuberculosis, we are sick, we have cough, and then we would like to see a health facility that is welcoming for our healthcare workers and for our patients. So I would just like to give a shout out to Nippon Paint, who actually part of their CSR support the Department of Health in the repainting of 8 TB clinics in selected regions. And this was very much appreciated by our patients. There are also some public relations initiatives who write articles about TB, so we'll be able to destigmatize TB, get information, because the fake news are very much prevalent. So we have to go to resources or websites where appropriate and correct information can be shared. Now, for the continuum of care across screening, diagnosis, treatment, and prevention, it really will require multi-sectoral collaboration. And in the workplace, it starts with our effective pre-employment evaluation, our annual X-ray, because this is a very good screening tool for tuberculosis. But we have to improve the turnaround time for our tests so that patients would not wait for 2 weeks or 3 weeks just to get the results, just to get their X-ray results. So there are a lot of technologies already being done, like your artificial intelligence that for TB screening. We also have the ultra portable X-ray to be used at point of care, and also the choice of providers. So there we have to look at the directory per workplace to have a directory where the providers can be located and to be referred to. Of course, we have to modify the risk factors so that we do not develop TB across. Diagnosis is important that workplaces identify where they can have their TB diagnostic test and hopefully look for providers to offer friendly one-stop services. Of course, we have the contact tracing. We have to address stigma about the medical leave and health benefits. I think Dr. Jeremiah will talk about this one. And then for treatment, we can also support treatment by having our safety officers serve as treatment supporters for our workers with TB. Make sure that we are worker friendly and that the workplaces become partners for TB control. And of course, for prevention, we offer prophylaxis or the TB preventive treatment for those eligible. And the mere fact that we undergo annual chest x-ray and we do pre-employment, these are preventive measures to be able to have a TB-free workplace. Now, I would just like to give you some updates on the cascade of care. Let's start with screening. We know for a fact that if you already have symptoms of 2 weeks or more, then the provider will directly instruct you or advise you to collect your sputum test to be tested. And this happens among 32% when they are diagnosed to have TB based on the symptoms. But most of our patients do not have all these symptoms, 2 weeks cough or 2 weeks unexplained fever or weight loss or night sweats. So they undergo chest x-ray and most of the time the presumptive TB is actually determined with your chest x-ray. And if your x-ray is suggestive of TB, by all means, do your collection of your sputum because this is the uh, confirmation whether you have TB or not. For the workers, we have the annual x-ray. And if our x-rays are suggestive of TB, then we have to collect our sputum to confirm TB. For health workers, it's not only annual x-ray, but also cough surveillance in between their annual chest x-rays because they're exposed to patients who may have TB. Now, we just like to promote the principle of contact investigation, where an index case, or if you have a worker or a household member who has TB, they should identify all household contacts to have to subject for contact investigation so that they'll be able to know whether they also have TB. So there are means to rule out tuberculosis among the contacts. And this is how we do it, either through X-ray among patients who are 5 years old and above, and then for those who who are above 5 years old to undergo your X-ray if there are index cases. Now, for testing and diagnosis, just to inform you that X-ray is not the confirmatory test. So if you do receive your X-ray that is suggestive of TB, then please urge your healthcare worker to proceed to bacteriologic testing because the X-ray is not specific. It might be pneumonia or other non-TB conditions. And there are a lot of rapid molecular tests that are already available, like your Gene Expert. So you'll be able to confirm whether you have tuberculosis, and more so if you have resistance to tuberculosis, rifampicin resistant tuberculosis. Now, I would like also to inform you that there is a initiative to form a consortium of private laboratories and hospitals who offer a cheaper price of your Gene Expert. So you can just look at this website and be able to look at the different members of consortium who are already offering the Gene Expert at the lower price. But of course, the Gene Expert is actually free in government facilities in the nearest health centers and selected hospitals. We also have the TrueNut assay, which is another rapid molecular test to confirm TB. We also have the TB lamp. So these are additional diagnostic tests that we might undergo should this be available in the setting of your provider. Now, recently, we also have the Department of Health integrated the lateral flow urine lipoarabinomanam assay. This is actually useful for HIV patients. So for those who cannot produce sputum, then they can send their urine sample for testing for TB. But this is strictly for HIV patients. Now, for treatment, this is still the regimens, but there are now of efforts to look at how to shorten the regimen for drug-susceptible TB and, of course, for drug-resistant TB. Now, just to inform you that there are now some innovations that are related for treatment adherence. Safety officers in workplaces can actually be trained as treatment supporters so that our workers need not go to the health center every day, but they can actually be the ones who would monitor their coworkers on their treatment compliance. And workplaces can receive the treatment or the TB drugs in the workplace so that it's easier for the workers. We also have some digital adherence tools like the video DOTS, where we use a video, an apparatus or a device, so they will be able to monitor the intake of your TB medication using video. We also have the electronic pill back for adherence monitoring. Recently, we have been introducing this Care TB app, which was developed by the WHO. It's a very useful app used by providers to monitor treatment adherence among the patients. And of course, there are already some patient support centers that have been established in some selected areas where patients are monitored through call or text. Now, for prevention, we actually have these risk factors that we have to address so that we prevent and avoid developing TB. So we have to address malnutrition, HIV, alcohol use, smoking, and diabetes, because these are the 5 risk factors that if we address will actually reduce our ability to develop tuberculosis. And lastly, of course, if we are to make sure that we don't have TB, let's undergo our annual physical exam, make sure that we provide that to our workers, and make sure that we choose X-ray providers that provide quality care, quality services, quality X-ray services. Now, among the for TB infection, we actually have to do contact investigation if there are contacts of index cases, and then we offer TB preventive treatment. TB preventive treatment is a regimen given for 3 months or 4 months or 6 months, depending on what regimen is available, so that we will reduce the possibility of a patient being exposed to develop active TB. So this is my last slide, ramping up TB response in the workplace. We have to beef up health promotion in the workplace, but by using the tools that I've mentioned earlier, we have to make sure that we offer annual or pre-employment X-ray to our workers and offer TB preventive treatment for those eligible. We have to make sure that we link our workplaces to TB services that provide quality care, and also make sure that our company doctors are oriented on how to notify TB by reporting patients who are diagnosed to have TB and their treatment outcomes. So thank you very much, and I'll be happy to answer questions later on.
Thank you for that, Doc Mortera. So we've heard similar concepts then again from the thank you for that updates on TB prevention response in the workplace. So we've been hearing familiar concepts from the past pandemic, like contact tracing and index cases. So TB, like COVID-19 is also a respiratory disease. So let's go on to our second speaker. Our second speaker is a senior occupational health officer of the Health Control Division of OSHC. He is a fellow of Philippine College of Occupational Medicine. Let us give it up for Dr. Jeremias M. Florante to discuss supplemental guidelines on the implementation of safety and health measures for the prevention and control of tuberculosis in the workplace. Doc Jing, you may now share your screen.
Maraming salamat mo, PJ. Kita po ba?
Yes, Doc, we can see your presentation clearly.
Thank you very much. Okay, pleasant morning to everyone. I would like to thank our Training and Public Information Division for this webinar series highlighting the newly released regulations on the prevention and control of TB in the workplace and other similar updates ensuring the health and well-being of our workers. The objectives of for this segment would be for the participants to be able to discuss the issuance on the prevention and control of TB in the workplace. After this webinar, and likewise, the participants will be able to enumerate the policies, the salient policy and program elements on how TB can be prevented and controlled in the workplace. Tuberculosis can be prevented and controlled in workplaces. As mentioned earlier, the government and through the Department of Labor and Employment, or DOLE, came up with guidelines on how to assist private establishments in this endeavor. But you may wonder why involve the workplaces in these health initiatives when it can be done solely by the public health system through the Department of Health and its counterparts in the local government unit. We have to understand that workers spend a significant portion of their time at work, that is, a minimum of 8 to 9 hours daily, with existing facilities, services, and personnel in the companies. In workplace, it is relatively easy to implement health promotion programs and activities, including establishing referral mechanisms with health facilities. I'm sorry. Yeah. Including establishing referral mechanisms with health facilities offering TB services, and monitoring and reporting would be easy to facilitate as well, since the infrastructures are already in place. Again, aside from the fact that it will be easy to implement the prevention and control programs on TB in workplaces, the disease can be considered as a workplace health concern as well. This is so because transmission can occur in the workplace, especially if a TB-infected worker enters the establishment and infects other workers inside. Hence, the safety officers and occupational health personnel must see to it that all necessary measures are in place to thwart any cross-infection inside company premises. Factors enhancing workplace transmission must also be managed. As shown in your monitors, there are some of the workplaces that may be considered high risk for the transmission of TB. These establishments either cater to clients who are presumptive of TB, overcrowded, or with poor ventilation, or exposed to certain agents that increases their risks of contracting the disease. Speaking of certain agents that increases the risks of getting TB, silica exposure can increase the risk of TB even in the absence of silicosis. Some researchers believe that reduced occupational exposure to silica particles is effective for reducing TB incidence. Also, decontamination of work environment from silica particles can significantly reduce number of TB cases. This increased risk may be attributed to the destruction of the lung architecture by the accumulation of the silica dusts in the lung itself. Affected workers are usually the miners, workers in the quarry fields, construction workers, particularly those involved in tunneling works, millers, and among others. Here is the basis of the workplace initiatives on the fight against tuberculosis in the workplace. But the spread of TB can be prevented in the workplace. Here are the following strategies that can be employed by you with the assistance of the other members of your company's safety and health committee. 1. Set up a TB prevention control policy and program in the company. 2. Advise workers to consistently practice proper cough hygiene, such as covering the mouth with a handkerchief or paper tissue and not with bare hands, every single time one coughs or sneezes to prevent the spread of TB bacteria, or resort to coughing or sneezing into the elbow if the handkerchief or paper tissue is not available. Better yet, wear face mask. Number 3, make the workers conscious of the cardinal symptoms of active TB disease for early diagnosis and treatment. Advise them to consult with the physician in the company clinic or a nearby health facility with TB services and immediately start with anti-TB medications if diagnosed with TB. 4. Chest x-rays performed as part of the pre-employment medical examination and or annual physical examination of workers with findings suggestive of PTB or pulmonary tuberculosis should be referred to health facilities with TB services for proper evaluation and management. 5. Workplaces need to establish linkage with nearby health facilities with TB services to facilitate referral and access to services, ensuring prompt testing, treatment initiation, and treatment completion among workers diagnosed to have tuberculosis. 6. Ensure proper protocols for contact investigation among workers diagnosed to have tuberculosis are in place to identify the exposed individuals eligible for TB preventive treatment. 7. Minimize crowding of workplaces. 8. Ensure proper ventilation in the workplace. 9. Encourage workers to strengthen their immune system through a healthy lifestyle. To institutionalize the prevention and control of TB in workplaces, the Department Order Number 73 Series of 2005, or the Guidelines for the Implementation of Policy and Program on Tuberculosis Prevention and Control in the Workplace, was issued by the Department of Labor and Employment. It required private enterprises to develop and implement their respective policies and programs against tuberculosis and ensure a safe and healthy workplace for its workers. The components of the policies and programs include prevention, treatment, rehabilitation, compensation, work accommodation, and reintegration and non-discrimination. Although treatment remains a key component of the guidelines, the need to comply with the Occupational Safety and Health Standards as amended and Republic Act Number 11058 and its accompanying implementing rules and regulations, the Department Order Number 198 Series of 2018, which promote good working conditions, thereby reducing the risk of disease transmission, are also recognized. These pieces of legislations also clarify the medical and health benefits and social policies on non-discrimination, reasonable working arrangements, and restoration to work. Private companies must implement the Department Order Number 73 Series of 2005 and follow the protocols provided in the latest manual of procedures developed by the National Tuberculosis Control Program of the Department of Health. All private establishments, regardless of its size or number of workers or employees, are required to develop a policy and programs on the prevention and control of tuberculosis in the respective workplaces in coordination with their workers. It may be integral to the company's occupational safety and health policies and programs. The Safety and Health Committee of the said enterprise oversees the implementation of the developed policies and programs. Correct information about the disease and how it can be managed must be disseminated to all workers. Facts and data on tuberculosis can be retrieved from reputable sources such as the Department of Health, Occupational Safety and Health Center, and even international sources like the World Health Organization, U.S. Centers for Disease Control and Prevention, among others. To provide the right and appropriate information to the workers, The company's occupational health personnel and other concerned members of the Safety and Health Committee must be capacitated. The Department of Health, the Occupational Safety and Health Center, the Philippine Coalition Against Tuberculosis, the Philippine College of Occupational Medicine, the Occupational Health Nurses Association of the Philippines, the Employers Confederation of the Philippines, and other concerned government and non-government organizations may be able to assist you in the capacity building. Improving workplace conditions must be one of the priorities to manage not only TB, but also other infectious respiratory illnesses. Part of the company policy and programs in the prevention and control of tuberculosis in the workplace is managing the illness itself. The Directly Observed Treatment Short Course, or DOTS, may also be known as TB DOTS or TB DOTS, is the name given to the tuberculosis control strategy recommended by the World Health Organization. As mentioned by the previous speaker, it has now been replaced with a Stop TB strategy with the same goal of ensuring our workers and workplaces free from tuberculosis. According to the World Health Organization, the strategy is a cost-effective way to stop the spread of TB in communities with high incidence. Hence, referral to health facilities with TB services is being advocated. Company health personnel may act as treatment supporters to their workers with active TB disease or TB infection. Under this setup, free TB medicines can be endorsed to the company clinic for dispensing to the worker by the trained company health personnel. Linkages with the nearby health facility with TB services need to be established for this purpose. Companies must report all companies must report all diagnosed cases of TB to the regional offices of the Department of Labor and Employment using the appropriate form, that is the Annual Medical Report or the AMR. This is in compliance with Republic Act number 11058 and its implementing rules and regulations, the Department Order number 198 series of 2018, the Occupational Safety and Health Standards as amended, and to the Department Order number 73 series of 2005. In all instances, workers with TB or presumptive of TB must be protected. The company shall practice non-discrimination of workers with or who had been treated with TB, particularly those who complied with the prescribed treatment based on the existing protocols. If any case of discrimination occurs, the aggrieved party may approach the nearest regional or field office of the Department of Labor and Employment for assistance. Alternative work arrangements may also be provided to the affected workers while recuperating from the disease. A worker with active drug-sensitive TB disease may be allowed to resume work as early as 2 weeks after the start of the treatment, depending on the recommendation of the company's healthcare provider and or the health care facility with TB services. Treatment response of workers with active TB disease or presumptive pulmonary TB shall be monitored through follow-up diagnostic tests and clinical signs and symptoms. Also, company health personnel and health facilities with TB services should ensure that all workers undergoing anti-TB treatment will comply with the respective follow-up schedules. For workers who are diagnosed with drug-resistant TB, the company health personnel shall coordinate with the physician from the treatment facility with programmatic management of drug-resistant TB services for fit to return to work clearance. The roles and responsibilities of the employer, workers, and workers with TB or at risk for TB must be emphasized in order to effectively prevent and control the health concern in the workplace. These roles cannot be understated if we really want to contribute to ending TB by 2035. The Occupational Safety and Health Center, alongside with the other partners, will provide the necessary and appropriate technical assistance to the private establishments in the implementation of the workplace TB programs. On the other hand, the Bureau of Working Conditions and the regional offices of the Department of Labor and Employment will enforce the implementation of these guidelines. Just recently, the Department of Labor and Employment released Labor Advisory number 21 series of 2023, or the supplemental guidelines on the implementation of safety and health measures for the prevention and control of tuberculosis in the workplace. The new labor advisory is in accordance with various laws that aim to ensure the health and safety of the workers. The new regulation can be downloaded at the official websites of the Department of Labor and Employment, Bureau of Working Conditions, and Occupational Safety and Health Center. It also includes a list of healthcare providers with TB services all over the country. The new labor advisory is a reiteration of the Department Order number 73 series of 2005. Though it gave emphasis on the access of our workers to healthcare facilities offering TB services and the available government programs ensuring their health and well-being. Provision of work accommodation and such other work arrangements for our workers affected by the illness were also emphasized. Our workers with TB may continue working provided they continue with their medication and cleared with their physician. As with any other illness, medical records must remain confidential in accordance with existing laws and regulations. Though employers are required to submit to the regional or field offices of the Department of Labor and Employment the annual medical report indicating the number of workers who underwent chest x-rays and diagnosed cases of tuberculosis. This is also one of our contribution to the national data on tuberculosis. To our occupational safety and health advocates, please remember that in the development of good workplace program, you have to consider these pointers as shown in your screens. These are the salient points on the issuance of the Department of Labor and Employment. Lastly, a good TB prevention and control program in the workplace must include the strategies as shown in your screens. These strategies are rights-based and ensures the safety and health of everyone in the workplace. We hope you have learned a lot from this presentation and thank you for listening.
Thank you for that, Doc Jean. So we are now then reminded again to revisit, revise, and always keep up to date with our TB program. So for our safety officers who are watching with us right now, who are with us in Zoom or in Facebook, this is a reminder for you to always include or always always include or revisit your TB programs in the workplace. So are you still with us? Can we get a heart reacts or any reacts, just not angry or sad, from our Facebook and our Zoom? So you can also drop in our chat box and in our comment where you are now while watching our Facebook or our Zoom, so we can know if we've reached the Mindanao region or the Visayas region or even overseas. We'll be glad to have you here to be with us this morning, Philippine time. So thank you for that again, Sokjin. We are now getting to the exciting part. I'm sure you don't want to miss this portion. Here with us today is the team leader of Millennium Development Group, Division Chief of Standards Monitoring Department of the Philippine Health Insurance Corporation, to discuss the PhilHealth Consulta package on TB PhilHealth Consulta packages for workers with TB. Let us welcome Dr. Mary Antoinette Y. Remonte. Doc Anne, you may now share your screen.
Okay, good morning, everyone. Let me share my screen.
It's still loading.
The device.
So if you have any questions in mind for our resource speakers, you can reserve it for now. You can type it in later in our open forum so that it would be addressed later on. So just a little reminder, for your questions, keep it simple and um, keep it those that were not discussed during the lecture
Yes,
of our
there's a time.
speakers. Doc Anne, we can now see your screen. So I'll just read some comments from our chat box here in Zoom. We've reached Tacloban City. Hello, Sir Mark.
Nakita na po?
Ah,
Yes, okay na.
yes, Doc Anne, we can now see
Team
your
the
screen.
okay na ba? Okay. So I will be discussing the current benefit packages. We have two, the TB package per se and a primary care benefit package which we call Consulta. Then later on, in the future, these benefits will be harmonized such that uh, it will be part of the comprehensive outpatient benefit package. So currently we have the TB Dots package. It was launched in 2003. Actually, it was announced in the year 2000 as a gift or as a part of the benefits for workers during Labor Day. And then 3 years after, PhilHealth launched an outpatient TB Dots package for drug-sensitive TB, which may be availed from accredited DOTS clinics. So this is the content of the package. It is the package is 4,000 but paid in two tranches. First is after the intensive phase, which is usually after 2 months, and then after the continuation phase. So laboratories during the treatment and consultations. To avail of the TB Dots package, a diagnosed, so take note, this is already a diagnosed patient, will go to the TB treatment center or TB dots clinic for treatment. Then upon completion or end of each treatment phase, the facility or the health claim to PhilHealth. Treatment center for usually for treatment, for which PhilHealth, the facility will file the claim upon each treatment. No, and PhilHealth will pay the TB dot centers for every treatment completed. So this is just the summary of the package. It's for the members and dependents in accredited TB dot centers, and it only covers drug sensitive tuberculosis. Now let me go to another package for primary care, which is the PhilHealth Consulta. The origin of this package is in the year 2000, PhilHealth launched an outpatient consultation and diagnostic benefit, or what we call OPB, for our indigent members. Eventually, it became the primary care benefit, but still for indigent. Then in 2018, we expanded it to employed sector, and in 2020, as with the Universal Healthcare Act, we expanded it to all members, or to all types of member categories of PhilHealth. So what is this PhilHealth Consulta? It's a primary care benefit package which covers consultation, diagnostic tests, initially 13 diagnostic tests, and 21 molecules or medications. So these are the list this is the list of services covered under Consulta. So for laboratories, it covers this range of diagnostic and screening tests, and some medications like antibiotics, anti-asthma drugs, anti-diabetics, anti-hypertensive, and even for dyslipidemia. I would show how PhilHealth envisions to the payment based on the performance of the healthcare provider or consulta provider. So it will look into the access, provision of targeted services, coverage of medicines, and the outcomes, as well as the satisfaction of the clients. But this is PhilHealth will pay the provider for every member enrolled for the Consulta package. I will not dwell into this, but as a PhilHealth member, the workers and every Filipino now is qualified to avail of the Consulta package. So this is the process of availing. First, the member or the beneficiary would register into an accredited Consulta package, either through self-registration via our member portal, or assisted through local government units and other authorized third parties. Like in case of senior citizens, they may be assisted in the senior citizen or senior citizens office. Then upon registration, the beneficiary now or the member will go to the consulta provider, or in some instances, it's the healthcare providers, their health staff will go to the community and conduct health screening, get the health profile of each beneficiary or member assigned to them. Because upon this, after this profiling or assessment, they submit this to PhilHealth, and PhilHealth will now pay them for the first tranche of the benefit. So since there is already, with the identified health risks and health conditions, to the to his or her consultant provider. And then if needed, laboratories may be done. And as I shown before, those laboratories are based on the diagnosis, medications may be prescribed. Based on these three, consultation, laboratories provided, and medications, PhilHealth will pay the remaining 60% based on the performance, and the services provided by the health facility. So let me go back to the services covered under the Consulta package as it is now. If you would notice, I highlighted the sputum microscopy and chest X-ray under the laboratories. So essentially, that's about which is chest X-ray is covered by the primary care package or the Consulta package. So the treatment of TB of a worker or any PhilHealth beneficiary is covered by two benefit packages. So the screening, which includes chest X-ray, and for now it's only sputum smear or sputum microscopy, is covered by the Consulta package. Once diagnosed, then the patient will go to an accredited TB treatment center, for which PhilHealth will cover the treatment of TB under the TB DOTS benefit package. So right now, as I said, these services are covered by two separate packages. Now let me go to the future, which we are about to test. Because as a result of the Universal Health Care Act, which states that PhilHealth shall implement a comprehensive outpatient benefit, including outpatient drug, emergency services in accordance with Health Technology Assessment Council, then PhilHealth will implement a comprehensive outpatient. At the start, it will integrate the full and existing benefit
Doc Ann,
package.
hello. Your line is a bit choppy, Doc.
With the consult will now, that okay. Wait. Hold on. I will use the other.
Okay, I think Doc Ann is experiencing intermittent connection as of the moment. Okay.
Now,
Um, there's a loud feedback, Doc.
How about now? May feedback pa?
It's all clear now, Doc.
Yan, may feedback pa?
None, sir. None,
No
Doc.
more?
No more.
Okay. Again, I will continue.
So that's the proof that we are live. We're experiencing technical glitches. That's the downside of technology, but at least we have this meeting.
Okay. Okay na?
Yes, Doc, we can hear you clearly and we can
So,
see your screen.
as in accordance with the Universal Healthcare Act, PhilHealth will now move towards developing a comprehensive outpatient benefit package. But this is a progressive realization. So over time, PhilHealth will continue to expand and add services under its primary care benefit package. So for now, the Consulta will be will be Consulta Plus, which will include existing standalone outpatient packages, such as the TB Dots package. The PhilHealth Consulta will be this is agnostic and provides comprehensive set of primary care packages, and it will be the chief no among its facilities, while the standalone outpatient packages are those disease or intervention specific bundles of services that can be provided in an outpatient setting. So this is the benefit, design, and inclusion of the Consulta Plus. No? So it will be now called, because TB is part of the MDG or an SDG. Um, so it will be called Consulta plus SDG. So there is Consulta, and then there will be Consulta plus SDG related benefits, which will include the TB dots and other benefits such as HIV, malaria, and our package for animal bite treatment. But this time, in the it will be taken care of, the beneficiary or the patient will be taken care of by a network. But the services, no, initially from uh 23 laboratories, 21 drugs, the services will be expanded to cover for the diagnosis of TB, HIV, and malaria. So these are the diagnostics or laboratories that will be covered under the Consulta plus SDG. And now the medications, aside from the 21 molecules, will include no, the medications for TB, HIV, and even the rabies, anti-rabies shots. This is how the PhilHealth will pay no, the expanded consulta. It will be There will be a base payment or a capitation per individual. Then there will be payment for malaria services and a pay for performance for um, no, for per individual with completed mandatory health services. Okay, this is the weights no givens, because we will be computing based on the performance. So this is the weights and the basis, no, on the rationale. So this is more relevant, no, if you are a consulta provider. But we just like to note that part of the performance that we will be looking into before we pay the consulta provider is the uh, testing, no, for TB using the gene expert, and also the treatment of TB, treatment initiation of TB, and completion of TB. So this will be part now of our payment, no, of our consideration when we pay the provider. So this is the availment process of consulta. So beneficiaries, as with the current consulta, will register to a consulta provider, and it's the primary care provider or the consulta facility that will um, provide the services but also act as a navigator. It will be referring patient, such as those that need TB treatment or TB diagnosis for TB, to its affiliate primary care providers for the needed services. So this is actually the last slide. So now, the PhilHealth Consulta and the TB Thoughts package will be um, provided under one network or under one provider. It will not be separate anymore. No, so under that network where the patient or the beneficiary registered for consulta, he or she will be given the necessary services, including the diagnosis of treatment. So for workers, it is necessary that they would be advised to register already in their consulta provider of choice for them to be profiled, to be assessed of their health risk, and if needed, undergo screening services such as chest x-ray and could be treated for TB. That is covered by a PhilHealth package. So the Consulta plus SDG, no, will be the future in the next few years. Currently, it will be implemented or it in selected sites for testing, but the goal of the PhilHealth Consulta plus SDG benefit is to act as primary care benefit among the universal healthcare mandated policy reforms, and to assess the implementation and to evaluate health system readiness before it could be launched uh, in every area or every regions in the Philippines. So with that, maraming salamat po. Thank you for inviting PhilHealth and discuss our benefits. Over.
Thank you for that, Doc Anne. Although we have experienced some technical difficulty along the way, we are very thankful for your lecture for this morning, since you have a very comprehensive and elaborate visual aids. Okay, I'll just wait for Doc to stop share. Okay. So I hope our dear participants, you're still with us this morning. Just hold on to your seats because this is now our last portion. For our last portion, we have our strong partner in advocating safety and health at work. We have the Employers Confederation of the Philippines to showcase their e-learning on hashtag work TB free. We have Ms. Rodora B. Snyder, head of ECOP OSH Academy, and Ms. Sheila Marie Ramos, ECOP OSH Academy Specialist. Ms. Rodora?
Okay, so good morning, everyone. So I'll be presenting in behalf of the Employers Confederation of the Philippines. I hope my audio is clear naman po.
Yes,
Can
you're
I get a
here.
confirmation? Thank you. So thank you to the Occupational Safety and Health Center for the opportunity to share Lawyers Confederation of the Philippines program on eliminating tuberculosis in the workplace. So this is called Work TB Free. And this initiative is supported by the USAID through the Family Health International 360. And this program is also in line or in relevance to the National Occupational Safety and Health Standards based on RA 1058 and the National Policy Framework, which was also mentioned in passing during the first presentation on the promotion of healthy workplace, and the PAAP or the Philippine Acceleration Action Plan for TB 2023 to 2025, and the global call to end TB promulgated by the World Health Organization or the WHO. So today I will be presenting our e-learning tools, which is the TB in the Workplace e-learning modules lodged at the ECOPS e-campus, and also the Work TB Free PH platform. But before that, I'll be also discussing the different initiatives that ECOP has already done in the TB in the workplace. So in 2019, ECOP, together with the Family Health International 360, developed the module on how to install effective TB control and prevention in the workplace. Likewise, ECOP also is the secretariat that convenes the technical working group of TB in the workplace together with other tripartite partners, the DOLE, Occupational Safety and Health Center, BWC, and together also with other union groups from the FFW, TUCP, and from the other organizations, PICOM, ONAP. So through this collaboration, we were able to drum up or start our initiatives. As seen in the screen, we organized or conducted baseline survey among our ECOP members to know their current knowledge and awareness, and also their practices when it comes to TB in the workplace, whether they are having already programs or already conducting um, chest x-rays during pre-employment and during the employment. And also, in terms of awareness, we also organized a series of webinars during the pandemic about TB, so like TB 101, no, and dispelling the myths around TB. And lastly, as mentioned, developing a training curriculum in partnership with FHI 360. So currently, this year, we are more open face-to-face, and ECOP has planned out some strategies for engagement. No? So mas bumaba po kami ngayon sa mga companies and also with our chapter members through consultation meetings and also half-day forums, and also conducting again yung rapid assessment para mas ma-update yung kanilang mga current practices since nagkaroon na ng COVID-19 pandemic. So how has it affected yung kanilang pag-implement, or kung meron na ba silang talagang nagawa na TB in the Workplace program. And in terms of promotion, we also have different promotional posters and materials that we distributed in the forums and also in the consultation meetings. And these materials are developed in partnership with FHI 360. So yun yung mas binibigay namin, and workplace-based siya, and pwede talaga siyang ilagay or ipaskill dun sa mga different company workplaces. And also monitoring the progress through tier classification. So later, we'll be knowing this more under dun sa Work TB Free PH na platform. And also, no, sustaining the e-campus, which refers dun sa e-learning materials. And lastly, aside from that, we also are convening yung ating mga tripartite partners through the PWG na na-mention namin kanina. And lastly, also, ECOP has already developed a TB module as part of the loss control management training. So for those who are familiar or yung mga safety officers na participant, so ito yung advanced OSH training na tinitake natin. So we develop a specific module, TB module for this po. So next slide. And as part of the sustainability of this initiative, as we know, ECOP is also a safety training organization accredited, and we plan to establish yung Work TB Free as a core and permanent program under the Occupational Safety and Health Academy. So in the future, we will be offering this part of the training service for our ECOP members. But for now, at the end of the presentation, we really invite everyone, no, regardless kung ECOP member or not, to avail of or to enroll in this e-learning modules and in the platform kasi we still offer this for free and for public use po. And as well as part of the strategy is also developing info materials, background info on TB, TB's impact on business. So we will also include this in the sustainability plan of ECOP. So next po. So how can you participate? Be part of the TB network by being a member of this. ECOP is still finalizing, or this initiative is still on the work. So we are planning to organize corporate collaboration to end TB in the Philippines. So this is kind of a recognition initiative for those companies who will be planning or to implement yung kanilang mga TB in the workplace program. So this is also part of social branding, no, regardless kung small, medium or large tayo. It's better na makapag-start na, and we will still update you when it comes to this initiative. Next is to also participate dun sa mga upcoming naming consultations and forums, and to also join in the e-campus e-learning modules, which we'll also discuss po in the next few slides. So next po. So ito po, we have the e-learning modules and also the Work TB Free PH website platform. So next. So this TB in the Workplace e-learning modules aims to capacitate companies or workplaces on how to develop their own TB in the workplace program. So currently, this e-learning course can be accessed to the ECOP eCampus, which is our learning management system. And the development of these courses was made possible by the technical assistance from USAID and also in collaboration with DOLE and currently hosted by ECOP. So the e-learning modules aim to capacitate various stakeholders in the workplace. So course 1 is for the OSH personnel o yung mga safety officers or yung ating OH personnel sa ating mga companies or organization. Course 2 is a set of instructional materials and videos on how to use po yung ating web platform, worktbfree.ph, and to capacitate yung ating focal person sa ating workplace. While course 3 aims to sensitize yung ating mga key stakeholders within an organization on the impact of TB, no, by presenting business cases, testimonials from workplaces with existing TB programs, and the steps on how to establish our work TB-free programs. So in the next few slides, we have screen caps kung ano yung itsura ng course na is already present in the e-campus. So next slide po. So yan po yung ating course 1. Mga different na topics. So we have active case finding, yung implementation guide, and also yung TB 101 and some among others. So ayun po. So at the end of the presentation, we will be playing a video about the Work TB Free PH platform, and we'll also send in the Zoom chat yung link how to register, no, through Google Forms para po for those who are interested to enroll, you can easily access or easily enroll na po right now. So, yun lang po, and requesting po to play the video. Thank you so much.
Hello, and welcome to the demo of the Work TB Free platform. This is a one-stop shop platform for capacitating workplaces to learn about TB and reporting cases. To start, let us first briefly discuss the personas or the user types of the system. For the purpose of this demo, we will designate a background color for each persona to help us identify which screen is being shown. First, we have the members. They are the companies that will report TB cases in their workplace. They will also benefit from the learning materials about TB that will be provided to them. We will use a blue background for this user. Then, we have the moderator. They play a major role in engaging companies to use the platform. They can provide learning materials to empower their members in managing TB in the workplace. They can also see reports of their members into the platform. We will use a yellow background for this user. Last is the admin. Our admin will be the one to oversee and manage the processes that will take place in the platform, such as moderator enrollment and account verification, among others. They can also view the aggregated data that the members put into the platform, which will help them make well-informed policies. We will use a red background for this user. Go to www.worktbfree.ph. Here, you'll see information about the website. This is the homepage. Each tab here leads to the section of the homepage. We can see here the objective and project components, information about the platform, frequently asked questions, our partners, and our contact information. You can also subscribe to our newsletter by putting your email address in this field and by clicking subscribe. Let us go back to the top section. Interested companies can send applications to use the platform by clicking this button. They will be redirected to this Google form to register. This can also be accessed by clicking this link or this link. Basic facts about tuberculosis can be seen by clicking this link. Companies can only access the whole platform if their registration is approved by the admin. With this, let us now discuss the process flow of login and registration. When logging in as an admin, we just have to go to the website worktbfree.ph and click the login button. This will redirect us to this page. Just put in the credentials and click Login. You will see that a message will appear if login credentials are incorrect. Put in the correct credentials to proceed. Once logged in, we will be redirected to this page. This is the dashboard of the admin's account. Pending items are placed on the upper left side. We can also see here the total number of enrolled moderators, admin, members, and others. We can also see here the status of our members' accomplishment of learning materials. Lastly, we can also see some analytics from the reported data. If we want to add a company group or moderator, we can do it in two ways. Option 1. Click this plus icon. It will give us a prompt asking for the email address of the company group. The admin has to agree on the terms of service and privacy policy of the platform before proceeding. Option 2. Click this tab. It will redirect us to this page. Then click this Add button. Proceed by following the process we did in option 1. After that, we'll just have to wait for the company group to activate the account through their email. With that, let us now proceed to the process flow for the moderator's registration. Once the admin sends the invitation, the moderator will receive this email. They have to click this button to activate the account. Upon clicking, they will be redirected to these sign-up pages. They will be asked to fill in their company details. Once signed in, the screen will look like this. As you can see, the dashboard contains less info compared to the admins. Moreover, the moderator will only see data of the companies that they manage. They will not be able to see the data of other moderators. To invite companies or members to use the platform, we also have two options. Option 1. Click this plus sign. A prompt will appear asking for the email address of the company. Once done, click this button. The page will return here. Option 2. Click this tab. It will redirect us to this page. Click the Add button to show the prompt. Proceed by following the process that we did in option 1. The moderator will then wait for the member's registration as well as the approval of the admin before the member could gain access to the platform. With this, let us now discuss the process flow for the registration of members or companies. Just like the moderator, the member will receive an email that will ask them to activate their account. Once clicked, the member will be redirected to the sign-up page asking for the details of the company. The screen will then show this pending status. To proceed, they need to sign the contract or service intent, which they can download on the same page. In this agreement, the members express intent in using the system provided certain terms and conditions. Once uploaded, they have to wait for the admin to review and approve the file. The admin can access pending service intents through their dashboards. They just have to click this and they will be redirected to this page. To view the document, click this button. The admin will then click the Approve button so that the members could proceed to the next process. Once the admin approves the file, this dialog will show up, saying that they have become a bronze member. They will then be asked to upload the proof of their annual physical exam and wait again for the admin to review and process the file. The admin can then access pending annual physical exams through their dashboards. They also need to click Process and they will be redirected to this page. To view the document, click this button. The admin will then click the Approve button so that the members could finish activation. Once the admin approves the file, the member will then be awarded as a silver member. Once done, they will be redirected to the learning materials that their moderator uploaded in the platform. One of the things that a moderator can do in the platform is to upload learning materials about TB and its management. This can be accessed in this tab. They can add a module by clicking this button. Upon clicking, a prompt will appear asking for details of the module. Once done, click Add Module. To start a course, they simply click on the Start the Course button and finish the course. Once done, they will be sent a certificate which they need to upload to the platform. The moderator will verify the certificate by going to the Learning Materials tab. Under that, we will see a section for certificate verification. In here, we will see the uploaded certificates that need to be verified. To verify, click Process and Approve. Once the member has accomplished all the learning materials, another congratulatory dialogue will appear saying that the member is now a gold member. Once the member accomplished all the learning materials, they can now register TB cases into the platform. To do this, they have two options. Option 1. Click the Add icon in the dashboard. Fill up all the fields. Option 2. Click here or this tab. Add TB case. Fill up the fields, then add case. If the registration was successful, a congratulatory dialogue will appear saying that they are now a Diamond member. Once they have multiple reported cases, the dashboard will look like this. Individual case reports can help our moderators and our admins monitor trends of the disease and make informed decisions on the development of policies related to the management of tuberculosis.
All right, hello. So as we can see, we have really gone a long way with combating TB, especially in the workplace. We see that we have a strong partner in preventing and addressing TB in the workplace, and that is always prevention is better than cure. So that's why we have this kind of platform and information drive for you, especially our dear workers here in the Philippines, or our safety officers, to have your knowledge be updated and have up-to-date concepts about TB. So it is really a lifelong learning process, and that now we also have gone a long way in our webinar. We are now finished with our 4 speakers. In order for everyone to have some rest, to give our speakers a break also, for you to have some time to stand up and stretch your legs, and for you to digest the presentations, in order for you to formulate your questions for our speakers, we will have a 5-minute break. Then we will proceed to the open forum. Make sure to ask relevant questions which are not mentioned in their lecture and the ones you think needs clarification. Let us maximize the time of our speakers in answering questions which cannot be searched through our browsers. And may I just say that I am glad we have participants all the way from Davao, Zambales, Tarlac, Pangasinan, Cebu. I hope next time we can reach overseas and those Filipinos abroad, because we want to optimize this webinar for everyone. So we'll be right back after these reminders from our office.
Kaligtasan sa trabaho sa matataas na lugar. Ang paggawa sa matataas na lugar ay mapanganib at maaaring sanhi ng pagkahulog. Tandaan ang mga paraan para kaligtasan sa trabaho sa matataas na lugar. Ang paggawa sa matataas na lugar ay mapanganib at maaaring sanhi ng pagkahulog. Tandaan ang mga paraan para aksidente ay maiwasan. Siguruhing may guardrails ang scaffold. Gumamit ng tama at naaayong fall prevention standards sa scaffold, guardrails, at hagdan na may handrails. Magsuot ng personal fall arrest system upang maiwasan ang pagkahulog. Tandaan, para aksidente ay maiwasan. Siguruhing may guardrails ang scaffold. naayong fall prevention standards, at pagsuot ng personal fall arrest system. Isang paalala mula sa OSHC. Personal protective equipment. Ano ba ang tamang kasuotan kapag nagtatrabaho sa isang construction site? PPE ang tamang kasuotan bilang karagdagang proteksyon kapag gumagawa. Ang hard hat ay proteksyon sa ulo sa nalalaglag na bagay. Safety goggles ay para proteksyonan ang mata. Earplugs ay panlaban sa matinding ingay. At face mask laban sa alikabok at usok. Proteksyon laban sa init at posibleng pagkagasgas ng mga braso ang long sleeves. Ang gloves ay gamit upang maiwasan ang pagkasugat ng mga kamay. Protektahan ang mga paa sa pamamagitan ng safety shoes. Kailangan din ng reflectorized vest upang madaling makita ang isang manggagawa lalo na kung sa gabi magtatrabaho. Kapag magtatrabaho sa mataas na lugar, huwag kalimutan magsuot ng full body harness. Libre dapat itong binibigay ng employer. May naaayong PPE sa bawat gawain. Siguraduhin lahat ng PPE ay pasado sa standards testing. Isang paalala mula sa OSHC. Ergonomics. Ang matagal na pag-upo habang nagtatrabaho at maling posisyon ay nagdudulot ng pananakit ng katawan, pananakit ng mga kamay, at eye strain. Kapag nagtatrabaho sa computer, siguraduhing tama ang height ng upuan at mesa para sa manggagawa, para tama din ang posisyon habang nagtatrabaho. Ang opisina ay dapat may tamang liwanag at ventilation. Ugaliing tumayo kada 1 oras ng pagkakaupo, maglakad-lakad o gumawa ng mga simpleng exercises. Tandaan para sa kalusugan, tamang gamit at posisyon, tamang liwanag at maaliwalas na paligid, paglalakad at ehersisyo mula sa pagkakaupo. Isang paalala mula sa OSHC. Kaligtasan sa paggamit ng makinarya. Ang makinarya ay nagpapadali ng trabaho, ngunit maaari rin itong maging sanhi ng aksidente. Upang maging ligtas ang manggagawang nagpapatakbo ng makinarya, inspeksyonin ang makina bago ito gamitin. Ang mga gumagalaw na parte ng makina ay dapat may tamang machine guards upang hindi ma-expose ang mga kamay, paa o anumang parte ng katawan ng gumagamit ng makina. Dapat regular ang preventive maintenance ng mga makina. Sundin ang lockout-tagout o LOTO system para makaiwas sa aksidente. Inspeksyonin bago gamitin. Machine guards. Regular na preventive maintenance. Lockout-tagout o LOTO. Isang paalala mula sa OSHC. "5S". Mahirap hanapin ang bagay na kailangan kapag magulo ang gamit. Maaari din itong maging sanhi ng aksidente. Mag 5S tayo sa ating mga lugar sa trabaho. Seri, sort o suriin ay ang paglalagay ng mga gamit sa tamang lalagyan at pag-aalis ng mga gamit na hindi kailangan sa trabaho. Seaton, systematize o sinupi naman ay ang pagsasalansan ng mga gamit upang madaling maabot ang mga ito at hindi makaabala sa trabaho. Sesa, sweep o simutin ay ang pagpapanatili ng kalinisan ng mga gamit at ng lugar sa trabaho. Seiketsu, standardize o siguruhin ang paraan para matiyak na tuloy-tuloy ang pagpapatupad ng good housekeeping sa pamamagitan ng pagsama nito sa OSH policy at program ng kumpanya. Dapat may shitsuke, self-discipline o sariling husa ang lahat pagdating sa pagpapanatiling malinis at maayos ang kapaligiran sa trabaho. Tandaan ang 5S upang aksidente ay maiwasan. Sort o suriin, systematize o sinupin, sweep o simutin, standardize o siguruhin, self-discipline o sariling kusa. Isang paalala mula sa OSHC. Tamang pagbuhat. Iwasan ang aksidente sa pagbubuhat ng mabibigat na bagay. Ano ba ang tamang paraan ng pagbuhat? Planuhin ang kilos at siguruhing walang sagabal sa dadaanan. Lumapit, hawakan ng mahigpit ang bubuhatin at gamitin ang lakas ng pinti sa pagtayo. Buhatin ng dahan-dahan at siguruhing diretso ang likod. Siguruhing malapit sa katawan ang binubuhat. Pag mabigat, pagtulungan o gumamit ng handling equipment. Tandaan sa tamang pagbuhat, planuhin ang kilos. Gamitin ang binti sa pagtayo. Siguruhing diretso ang likod. Ilapit sa katawan ang binubuhat. Pag mabigat, pagtulungan o gumamit ng handling equipment. Isang paalala mula sa OSHC.
All right, that's all for our short break. Surprisingly, we have few questions still in our question bank, but now we will now proceed to our open forum. The floor is now open for your questions. You may key in your questions in the Q&A panel or in the comment section in the Facebook. So I will now stop share my screen and ask the tech team to kindly spotlight our speakers so that we may begin our open forum. So I hope you learned a lot, our dear participants, with this morning's webinar. Okay, I'm just still waiting to spotlight. Are we all good, tech team? Okay. Doc Jing, are you ready? Okay. May I ask our
Yes.
speakers to...
Actually, nagsasagot na ako sa ibang
Yes,
questions sa Q&A box.
as we can see in the chat box. And thank you, Doc Naline, for turning on your camera. And then we ask Doc Ann to kindly turn on your camera as well. Who else? Miss Rodora and Miss Sheila, if you can grace us with your faces here in the Zoom. Okay. So, I think I'll start with this one. Good day po. Pwede po paki-elaborate on latent infection TB?
I think that's the question for me.
Yeah, Doc Martin.
Yeah. Okay, so when we say latent TB infection, you're not yet infectious, but you got the infection because you were exposed to somebody who had TB untreated. So you in 2 years' time, you may develop the active TB, and the likelihood for you to develop TB is 5 to 10%. So yung mga may risk, mas mataas yung risk nila na mag-develop ng active TB among those who have infection, yung mga bata, less than 5 years old, yung mga immunocompromised, yung mga may risk factors tulad ng diabetes, yung mga naninigarilyo. So these are the patients who are recommended na magkaroon ng TB preventive treatment para yung infection nila ay hindi mauwi sa active TB disease. Kasi ang active TB disease, ito na po yung nakakahawa at ito na po yung nangangailangan ng at least 6 na buwan ng 4 na gamot sa unang 2 buwan. So mas mataas po ang mga komplikasyon kung ang active TB disease ay hindi nagamot ng tama at ito ay nagkakaroon ng komplikasyon na. Kaya bago mauwi sa active disease, mas maganda yung infection pa lang ma-prevent na para hindi maging active TB. So, yun po yung ating tinatawag na latent TB. Kaya siya latent kasi natutulog. Pero hindi misconception po yun na pag natutulog ay pabayaan na lang. So, may mga measures po tayo para hindi magkaroon ng progression to active TB disease. So, sana na sagot ko yung tanong. My colleagues can also add up.
Okay, so Doc, and are you going to add something? Okay, so that's all. Next question is primary complex included in the program of the government? Any strategies to strengthen the screening process for this case? And lastly, do we have any national data for this case, primary complex? Thank you.
So, in terms of data, actually TB in children, they are the least that are being covered or detected. So parang nasa 20% lang sila. And there are many reasons. It's perhaps that they are not being diagnosed or they're not coming to the clinic. Now, in terms of kung included sila sa package, so siguro si Dr. Remonte can answer that.
Doc Ann, you have no audio. We can't hear you. I said, we can't hear you, Doc. Ayan, okay.
Now, okay na. So if the child has an active disease diagnosed, covered po siya. So yung TB Dots package is for pedia and adult naman po. But primary complex per se, kung hindi pa siya active, minsan kasi ano lang, nililabel siya as primary complex pero IPT yung parang preventive lang yung binibigay, hindi pa yon. Pero once na sinabi ng doctor na active to for treatment siya, mako-cover po siya sa basta sa accredited TB Dots clinic.
Okay, Doc Ann, don't unmute yourself muna. The next question is for you again. Is PhilHealth already regained the system or hospital or facility can process the PhilHealth transactions regarding the data breach, I think, na nangyari, Doc?
Ano po ulit? Sorry.
Okay, let me read again. Is PhilHealth already regained the system or hospitals or facility can process na PhilHealth transactions?
Okay. Yung hospitals po and yung providers and the members can access yung mga namin tawag doon, mga platforms, no. Pero sa PhilHealth side may mga iba lang po internally yung na hindi pa naka-restrict pa kasi inaayos. Pero yung link po from the provider to PhilHealth, yun po yung unang naging functional na. Over.
Okay, and the next question is it compensable if TB was gotten from the workplace?
Opo naman. Sabi nga, basta po active yung na-diagnose yung TB, kanina sinabi, hindi lang naman yun bacteriologically confirmed and even clinically diagnosed, tapos nag-treat siya sa accredited facility, mako-cover po yun. Yung drug-sensitive TB po, mako-cover po yun ng PhilHealth, regardless kung saan niya nakuha.
Okay po. Next question. Hello, same procedure po ba if umulit lang yung TB? Sabi kasi ni employee, nagkaroon na siya before. Natapos niya yung treatment, pero bumalik ulit.
Yung tanong niyan is may risk talaga na pwedeng bumalik yung TB. So hindi ibig sabihin na naggamot na ang pasyente at nakakompleto ng gamot, hindi na siya magkakaroon ever. So there's no such thing as immunity. And actually yung risk na magkaroon ng TB again is higher than those who never had TB. So, pero ang kailangan natin i-evaluate is kung talagang bumalik yung TB. Kasi it's possible po na nagkaroon tayo ng active TB at naggamot, pero may mga naiiwan pong peklat sa x-ray. So, hindi naman po ibig sabihin na pag yung peklat natin ay hindi nawawala, ay forever na tayo may TB. So, kailangan po ng masusing pag-aaral at correlation po ng doktor na tumingin po sa inyo para malaman kung yung TB nyo po ba ay bumalik or not. Marami po tayong parameters niyan. Ang una is kung yung sintomas po natin ba ay bumalik. Number 2, kung yung x-ray ba natin ay lumala kumpara nung dati. And number 3, kung ang plema po ba natin ay nag-positive ulit. Kaya nga importante po na ang mga pasyente po ay magtago ng lumang plaka at dapat po yung ating mga plaka ay kalidad. So for those who are yung mga doctors po natin, you are referring your patients to X-ray providers, make sure po na yung providers po natin ng X-ray services ay gumagamit ng quality X-ray services. Kasi po yung iba, after 2 weeks lang or 1 week or 1 month, nabubura na po yung plaka at naninilaw na. So ibig sabihin, baka hindi po maganda yung quality at baka expired po yung mga materials na ginagamit para iproseso ng film. So, yun po yung aming advice din sa mga doctors po para at least kung tayo ay need na mag-compare ng mga lumang plaka at bago, maganda po at madaling mag-compare dahil maganda yung mga plaka. Back to you.
Okay po. So, thank you for that, Doc. Next question, TB in the workplace po ba ay limited sa respiratory lang? Hindi po ba kasama yung ibang variant like TB in the bones?
Okay. Ang TB kasi, ang pinaka-common, 80% ay sa lungs. Dahil yun po yung entry or port of entry, nalalanghap. Kaya po tayo nagkakaroon ng TB kasi yung aerosolized droplet ay nalalanghap natin. So 80% pulmonary tuberculosis po ang presentation. Kaya lang po, may possibility din po na from the lungs ay pupunta sa ibang parts of the body. So yung nabanggit mo is an example of extrapulmonary TB, yung nagkakaroon ng TB sa buto. At sa ibang parts pa ng body, sa liver, sa kidney. So ibang parts po or organs ng katawan ay pwedeng magkaroon ng TB.
Okay, and then next
Thank
question.
you.
Thank you for that, Doc.
Allow me to add
Okay.
sa sinabi ni Dr. Mortera. Tama po yun. And our policy, the workplace policy, hindi dapat naglilimita na sa pulmonary tuberculosis lang. Lahat po ng TB, lahat po ng klase ng TB ay covered ng ating pulisiya. Okay? So as much as possible, kapag mayroon po tayong nakakitaang pulmonary or extrapulmonary tuberculosis, we advise actually na yung ating mga manggagawa ay may refer sa pinakamalapit na healthcare facility with TB services para sa libreng gamutan at saka sa proper evaluation. At dito na rin po maire-record yung kaso na mayroon sa kumpanya at may pasasama sa datos ng ating national TB. Yun na po. Thank you po.
Yes. So we really have to consider different types of TB, lalo if na siya kumalat na din sa ibang organ system. Next is, good PM, if TB due to underlying cause such as HIV, need ba i-declare sa MedCert ang HIV or only TB?
Paulit nga yung question. I did not get.
If due to underlying cause daw po ba, if yung cause ng TB is HIV, ano daw po ba i-declare sa MedCert? HIV or TB? Only. Ganun.
Of course, yung MedCert na hinihingi ay kung ano yung primary cause para nagkaroon ng disability yung patient or nag-absent. So, yung tuberculosis, yun po yung ilalagay. And then, kung ano man yung underlying factor, you may or may not indicate that. Pero depende po kasi kung anong purpose ng medical certificate. kung for clearance purposes lang, return to work, hindi naman kailangang ilagay doon yung mga underlying conditions unless na may mga situations where it is needed or merong impact sa infectiousness nung individual worker to the company or to the co-employees. So I'm not sure, Dr. Florante, you would like to weigh in?
Well, thank you very much, Dr. Mortera. Pero ano po, ang tinatanong ang cost kasi ng kanyang consultation yun. Ang reason ng kanyang consultation was due to TB, tuberculosis. So, I think yun lang po ang kailangan iyan. But aside from that, I just reminded ano po na since we are practicing data privacy, medical certificates should actually not be ang pinaka malayong mararatingan ng iyong medical certificate ay yung HR lang po ano. Hindi na po ito lalabas kung walang company clinic po ha. Or else sa company clinic lang talaga, the company clinic will issue another medical certificate certifying na fit to work na si worker with no diagnosis at all. Again, this is to stop the discrimination and to end the stigma na mayroon ano po sa mga lahat naman ng sakit dapat ganoon ang pag-treat natin ano po. And leave the diagnosis to the not to the workers, but to the doctors and to the healthcare providers. Basta magsinabi na fit to work, but take note also no, to the workers po, no? Banggitin po kung ano po yung klase ng trabaho, ano po. Kasi there are some cases wherein yung sakit talaga, gaya ng nabanggit ni Dr. Mortera, would have an impact ano po doon sa kanyang trabaho. Para at least yung doktor na magbibigay ng medical certificate would really have a good assessment ano po whether or not fit ka nga to work or fit for another task. Babalik ka sa trabaho pero that would be another task, not for the work that that was really assigned to you. Thank you po.
Okay po. So, I have a question din po. Actually, what is the position of PhilHealth in terms of co-infection of tuberculosis and COVID, I guess? So, Doc Ann.
So, co-infection ng TB and HIV, we have package for both outpatient HIV treatment and TB treatment. Separate packages siya sa ngayon. But it will be integrated nga into a comprehensive outpatient benefit later. Tapos yung maki-add lang ako doon sa discussion ng underlying cost, ang sinabi nyo na nga, Sir Paul, yung TB and HIV, co-infection yun. Ang underlying cause would be infection pareho. Hindi naman dapat cause ng TB yung HIV. Naging mas ano lang siya. Naging mas at risk lang siya, kaya nagiging co-infection. So, dalawa yung sakit niya, pero not because of nahawa talaga siya ng TB at nahawa siya ng HIV separate ng magkaibang organism.
Because we all know that PLHIV natin na mga kapatid ay really susceptible to opportunistic diseases po. No? So next question is, does smoking or e-cigarette or vape contributes po ba with the latent development of tuberculosis?
Okay, so in general, ang smoking, nakitaan po na tumataas ang risk natin to 2 to 3 times compared to a non-smoker para magkaroon ng TB. Ito ay nakita sa prevalence survey. So nakita doon na yung mga na-survey na participant na Pilipino na nag-positive sa TB, kung sino ang smoker at sino yung hindi. And nakita nga na ang mga smokers ay mas mataas yung risk na magkaroon ng TB. Now, wala pang datos na nakakapag-associate ng vaping. But we are, as pulmonologists and as experts of pulmonary health, ang vaping at ang sigarilyo ay hindi po nagkakaiba. Kasi ang sinasabi, mas safe ang vaping kumpara sa sigarilyo, when in fact they are both harmful to the body and to the lungs. So mas mainam pa din ng smoking cessation, yung wag pong mag-yosi, at hindi rin po alternative na yung vaping na lang kapalit ng smoking. Ang mas nare-recommend pa rin namin ay smoking cessation, tigil po ng paninigarilyo kaysa mauwi po sa vaping. And sa mga hindi pa naninigarilyo, ang vaping po kasi is the first step para magyosi naman. So both conditions are lifestyle disease conditions that kasama po yun sa healthy habits na dapat iwasan. Back to you po.
Okay po, thank you for that, Doc. And next question to PhilHealth again, yata to. With regard siguro to sa universal health program na din. Does indigent patients can also get monetary claims to PhilHealth? Thank you.
Paulit po. Sorry.
Does indigent patients can also get monetary claims to PhilHealth?
Wala po usually or lagi po ang payment ng PhilHealth is doon sa mga healthcare providers, so sa mga doktor, hospital, clinics, kung saan nagpatingin yung mga members. Ang mare-reimburse lang po yung mga membro, kahit na indigent, kung sila po hindi maiwasan na nagbayad. So, doon po, nagdi-direct file po sila na babayaran. Pero, per se na sila yung babayaran diretso, usually hindi po. Sa facilities po nagbabayad. Sa health facilities, nagbabayad yung PhilHealth.
Okay po. So, thank you for that, Doc. Next question. How should information from individual TB risk assessment be used?
Ano yung question? Parang malabo.
How should information from the individual TB risk assessment be used?
Yung self-assessment na binanggit ko kanina kasi it's an online self-assessment tool. So
Yes.
doon po tinatanong sa patient kung ang pasyente ay may sintomas, yung 4 po na cardinal signs, yung ubo na 2 weeks, yung pamamayat, yung lagnat. Tinatanong po doon kung may pasyente din pong may diabetes, kung meron pong ibang sakit. And then, meron pong algorithm po embedded dun sa self-assessment tool. At ang call to action after ma-fill up yung tool is ma-advise yung pasyente kung mas marapat na magpa-x-ray siya o mas marapat na magpa-sputum test na siya or mas marapat na magpatingin sa doktor para dun sa malaman kung ano yung meron siya. So, yung mga meron din doon, depende sa location ng pasyente. So, for example, ikaw ay nasa Caloocan, magkakaroon ng suggestions kung saan ang pinakamalapit na health center or facilities related to dun sa location ng pasyente. So, yun po yung kagandahan po ng TB self-assessment tool. Back to you po.
Okay, thank you for that, Doc. Then, what will happen to an employee with positive TB? Are they going to be terminated? Actually, parang ano to, discriminatory itong ano. Pero, yun
Hindi.
Doc. Answer na lang po.
Hindi po. Kapag ang si manggagawa po ay mayroong nakakitaan na may TB, ang una po dapat gawin ng kumpanya at ng Safety and Health Committee o kung wala safety officer kung wala man company clinic o yung company clinic mismo ay i-refer ang ating manggagawa sa pinakamalapit na healthcare facility with TB services para ma-evaluate at magamot, ma-manage po at saka may record din po po. Ngayon, mas advisable din po na si kumpanya ay maging treatment supporter po ni manggagawa. Usually 2 weeks time pwede nang bumalik. Once cleared pwede na pong bumalik sa trabaho si manggagawa. Huwag po natin dagdagan ang unemployment sa ng ating bansa. TB patients, workers with infected with TB can still be productive magamot lang po sila at mababantayan din po yung kanilang gamutan, mabigyan ng suporta po yung gamutan. We don't really advocate of terminating workers just because of their illness, po.
Yes,
Marami
and
tayo niyan, may mga sakit na halos.
opo,
So
and
no, thank you.
equal opportunity for everyone naman talaga. And
Tama
talaga,
po yan.
talagang doble ingat lang sa workplace. Ito po, next question. After po ba ng gamutan, meron po bang need gawin ng patient like frequent consultation and check-ups?
So usually after gamutan, meron pong monitoring tayo sa pasyente ng post-treatment follow-up for up to 2 years. So titingnan po natin kung ang pasyente ay fully naggumaling at hindi na nanumbalik yung sakit niya. Kasi may mga pagkakataon po na pansamantala lang pala yung improvement and then after a period of time, babalik ulit. So ito yung mga situation na baka nag-develop ng resistance yung pasyente or talagang hindi nagkompleto ng gamot, then malalaman po natin yan. So overall, tinitingnan din natin kung may ibang kasabay na sakit yung pasyente, hindi lang TB. So kung siya ay may diabetes, titingnan din natin yung mga comorbidities niya. Yun lang po. And then make sure po na yung mga kasamahan sa bahay ay talagang nag-undergo po ng tinatawag kong contact investigation para malaman din po kung sila po ay nahawaan ng TB at dapat din pong maggamot. Back to you po, Paul.
Okay. Talagang we need strong epidemiological surveillance din talaga to address this, kasi nga po, respiratory droplets yung mode of transmission niya. And next po, nakalagay po, bawal ang discrimination. Pero yung ibang company, ayaw na tanggapin ng applicant pag may nakitang peklat sa x-ray. Saan po kaya pwede humingi ng tulong kapag ganito ang situation?
Thank you very much. Sorry.
Ikaw na lang, Dr. Florante. Ikaw na lang.
Thank you very much po, no. Nakita ko nga ito sa Facebook. The problem is the policy, the guidelines did not mention of job applicants. It only mentioned of the workers. Assuming if the worker nagka-develop nga ng TB habang nagtatrabaho siya on the course of his employment, hindi po dapat ma-discriminate po equal opportunity again, work accommodation, and dapat maibigay yung karapatang tulong po, including the referral mechanism dapat ma-establish. So very very important na sa kumpanya mayroon talagang pulisiya at programa patungkol sa prevention and control ng TB po. Now, for the applicant, siguro ang masasuggest na lang natin for the applicant is to get a clearance from the pulmonologist na kasi cleared na siya, hindi active yung peklat o ganyan kasi marami namang mga kaso talagang ganyan. And I suppose these applicants would be considered maliban na nga lang po kasi mayroong mga certain work processes po mga certain na trabaho na would really require, lalo na pagpa-abroad, palabas. Mayroon silang mga pulisiya po na because of the nature of yung work na mayroon, would really require na dapat never had a history of certain infectious disease such as TB, something like that. So that would be another story po. At any rate, if you feel talaga na your right has been violated, our regional offices and the field offices of the Department of Labor and Employment ay bukas po para naman kayo po ay matulungan regarding this matter. Thank you po.
Sa mga implementation and execution of labor laws sa mga regional offices and field offices po natin tayo pupunta. Next is, how can we prevent TB when our work site does not have proper ventilation intake and exhaust? Ano ba to, Doc? Kailangan ba mag-N95 ba to?
Well, unang-una, nabasa ko rin nga po yan. How can we prevent when our work site does not have proper ventilation intake and exhaust? Siguro dapat kausapin ng inyong safety officer at dapat ang safety and health committee po ay magpulong-pulong. Siguro tingnan mag-hierarch po tingnan po magkaroon ng assessment para at least ma-improve ang working conditions. Bordering violation na to ng RA 11058 and we really have to you really have to answer this kind of issues because hindi lamang TB ang ating problemahin dito, marami pong mga sakit ang pwedeng makuha ng mga ating manggagawa. Hindi lang infectious po kasi mali natin malikabok pala ang iyong pagawaan o hindi lang TB ang makukuha, mayroon pang ibang mga sakit. So definitely, ang una po natin gawin, kontakin po, kausapin si safety officer at si safety officer naman po ay i-meet ang Safety and Health Committee and mag-conduct po kayo ng HIRAC po, hazard identification, risk assessment, para po makakaroon kayo ng pag-establish ng control, necessary and appropriate controls para hindi maayos po yung ventilation system and all.
Yes.
Yun po.
Thank you for that.
Thank
So,
you.
Dr. Jean, doon mo mako-correlate kung maraming kaso sa workplace na yon, kung
Opo.
mas mataas, relatively mas mataas yung mga incidents ng TB at ibang infection disease, even yung asthma siguro, then that would be a red flag, more or less.
Yes po, actually, it is a red flag. Hindi lamang po, malamang sa malamang, anong panahon ng COVID, 100 kung hindi maayos ang ventilation mo, 100% kayo parating nagsasara. Kasi iikot at iikot lang yung hangin and please be reminded also that the Department of Labor and Employment issued Department Order number 224 series of 2020 or 2021 ba? Regarding sa ventilation sa workplace, and it is an inspectionable matter so siguraduhin po na maayos po ang ventilation ng ating workplace yun lang po. Thank you.
Yes. And then next question, paano kung matagal ka nang hindi naninigarilyo? May possibility ba na mataas pa rin ang rate na magkaroon ng TB?
Of course, pagka smoker ka dati, tas nag-stop ka, bumababa yung bumababa yung risk mo to develop TB. Like yung risk mo din to develop cancer at yung ibang sakit. Kaya kung ikaw ay tumigil, congratulations po at wag na pong manumbalik sa paninigarilyo. So, yun po naman po ang benefit ng smoking cessation. Once na nag-stop po ng manigarilyo, yung mga risk po na na-associated with smoking ay bumababa naman. So, yun po yung aking i-recommend.
Yes, and actually let me just take this opportunity to plug the program of Lung Center of the Philippines, Quitline Philippines.
Oo, yung Quitline,
155.
yeah.
Yes, you can. It's a hotline that you can call to help you na tumigil na po sa pagsusmoke, and just follow the Twitter page yata to of at DOH Quitline. So the government is extending a lot of avenues for you to quit smoking for a better future. So next question would be, ito po, good AM, the sputum exam can be primarily considered lab test on suspect TB patient employee. Suspected TB employee.
Okay. Ang pasyente po kasi ay nagiging presumptive TB or suspected to have TB kung dalawa po ang condition. Una, nakitaan sa X-ray na malamang may findings doon suggestive of TB or may sintomas yung pasyente. At ang binanggit ko kanina, 4 yung cardinal symptoms na suggestive of TB, yung 2 weeks na ubo, na walang dahilan, 2 weeks na pamamayat, 2 weeks na paglalagnat, at saka 2 weeks na yung night sweats. So, pwede po maging presumptive TB kung meron po kayo nitong either nung dalawa. And lahat po ng presumptive TB, kay X-ray man yung nakitaan o sa sintomas, ay mag-undergo ng sputum test. Ang sputum test po, depende po yan. Pero ang pinare-recommend po namin ay yung rapid molecular test tulad ng Gene Expert dahil dito po nalalaman 2 bagay. Number 1, tayo po ba ay may active na TB? At pangalawa, meron na ba tayong resistance sa major na gamot sa TB like yung rifampicin? So, importante pong magpa-sputum test talaga sa mga pasyenteng nakitaan or presumptive or suspected to have TB.
Yes, and ayun pa, thank you for that, Doc. And to cap up our open forum, I guess, this is yung kanina pa nating tahimik na panelist, si Doc Ann. This is for you, I guess, Doc. Ito po kasi yung mga question nila, no, about compensation on versus SSS. Ito po yung sa questions nila, yung during the 2 weeks intensive TB treatment, can he or she avail the SSS sickness benefit? Pero may mga nag-ano din po na kung covered po ba ng SSS or EC pag EC claim yata to. Pag 4 months na yung case ng workers. And ito po yung last question, ano po ba yung mga statutory benefits na maaaring makuha ng workers na positive sa TB is the same po ba sa SSS as ano po yung system bracket? So, I think it's with regards na EC and SSS PhilHealth, packages.
So yung paggagamot po sa TB, nako-cover po siya ng SSS kasi may mga may pinapapirmahan po yung mga pasyente na sickness notification, nabibigyan po sila ng benepisyo sa SSS. Pero i-evaluate rin po siya ng SSS. Tapos, magkakaiba po yung benepisyo, no? Lahat po ito para sa mga manggagawa. Pero ang benepisyo po ng SSS ay yung pension at saka yung pag nagkakasakit at nawawala ng income. So yun po yung doon po papasok yung SSS na benepisyo. Yung PhilHealth naman po, pag nagkasakit at yung sagot sa paggagamot, yun naman po ang ng responsibilidad ng PhilHealth as National Health Insurance. So kaya po yung pag nagpagamot yung isang miyembro, gagamutin siya ng aming accredited provider, babayaran namin yung accredited provider, pero dapat po yung benepisyo namin ay binawas na dun sa gastusin ng miyembro. Yung EC naman po, yung Employees Compensation Commission, another benepisyo po yun kung ang TB o yung ibang sakit ay makikitang work-related, kumbaga na nakuha dahil sa kanyang trabaho. May mga certain occupation po kasi na pwedeng makuha yung TB, mas prone siya gaya nung kung nagtatrabaho siya sa mga health facilities, no? So mas marami siyang exposure. Yun po, i-evaluate din po yun naman ng EC kung work-related. So, pwede pong makuha nila yon tatlo na pare-pareho kung papasok po sila dun sa mga criteria na sinet.
Yes, okay, thank you for that, Doc. So that's it for our open forum. So sorry kung may mga nagtatanong pa po from other participants, but in the interest of time, we need to cut short our Q&A portion. So we are now nearing the exciting part also of our program for our dear participants. We will flash the evaluation link a little later, but for now, we would all like to thank you all for the active participation in our virtual seminar this morning. To formally end our program, may I call on our OIC Executive Director, Engineer Jose Maria S. Batino, CESO4 of Occupational Safety and Health Center.
Thank you, PJ, and of course, good morning, everyone. I was listening with the Q&A, ang daming interesting. There are so many interesting points. In fact, I agree with one of the doctors when she said that tuberculosis could be compensable. There was a time that I was officer in charge of the Employees Compensation Commission, and I could remember there were cases which were whereby ECC paid the compensation benefits to a member who got TB. But there were also cases na denied. But again, it depends on the situation, and I'm sure the medical evaluators of SSS they would really dig deep into the matter to determine whether tuberculosis is work-related or not. Pero yun nga, no, tama rin. Kapag yan ay work-related, on top of what the member can get from the Social Security system, meron din siya makukuha from the Employees Compensation Program. So again, let me thank our speakers for this webinar, no? Our very own, si Dr. Jing Florante, Dr. Lalane Mortera, Dr. Marie Antoneta Remonte, Ms. Rodora Snyder, and Ms. Sheila Marie Ramos for the very informative and relevant discussions on updates on workplace tuberculosis regulations. We have gone through respiratory disease pandemic, and today's topic is closely similar to it. So tuberculosis remains as one of the deadly disease in the world. It has affected millions of workers, and this number continues to increase on a daily basis. The lives of workers taken by the virus is incompensable in no other way. That is why we have this kind of information drive to promote TB-free workplace. So hindi lang naman po tuberculosis. It's not just the health domain that we get into a webinar to, but as far I mean, if you can look at our schedules, there are so many more webinars that are coming in on the health domains and on other aspects of safety and health. So the global and local situation are discussed this morning gave us a picture of where we are now and where we are heading. The additional guidelines on TB-free workplace issued by the DOLE aims to give an updated government standard to prevent and control tuberculosis. In line with this, the state health insurance company has rolled out package to aid workers and with TB. And lastly, we have occupational safety and health advocates who continuously develop new ways of educating workers against tuberculosis. While the government is doing its best to fight the disease, but of course, government would only have this much of resources. Employers and employees have also their shared responsibility in promoting TB-free workplaces and contribute to the eradication of the stigma and discrimination against those with tuberculosis. We hope that the knowledge you acquired from today's session will further improve your company's occupational safety and health policies and programs. And as Doc Jing has mentioned, napakahalaga ho ng HIRAC, ng hazard identification, risk assessment, and control. Everything would have to start, whether we're looking at injury prevention, whether we're looking at disease prevention, lahat na ho to would start from the very basic tool of hazard identification, risk assessment, and control. So let us continue to work together towards a safer, healthier, and more resilient workforce and workplaces. The safety and health of our workers and their working conditions should always be our top priority. We at the Occupational Safety and Health Center remain committed to fulfilling our mandate to provide technical expertise interventions in the advancement of occupational safety and health. Yun nga, lagi ko sinasabi, kami sa occupational safety and health, we can only advocate, di ba? That's also a government role, advocacy, advocate prevention. But of course, the ball game when it comes to prevention is the ball game of workplaces. So inaasahan po namin ang inyong patuloy na pakipagtulungan sa amin tungo sa advokasya ng occupational safety. Sama-sama po tayong lahat na isulong ang kaligtasan at kalusugan sa lahat ng manggagawa. Muli, magandang umaga at maraming salamat sa inyong walang sawang suporta sa aming mga programa. Mabuhay ang lahat ng mga occupational safety and health champions. Yun lang po at again, magandang umaga po sa ating lahat.
Thank you for that, Sir Jomar. Keep your webcam open first. I would like to ask everyone or dear participants and speakers to kindly open their cameras for a picture taking. Actually, to inform everyone also, parang sana dapat kasama natin si Sir Jomar kanina sa Q&A kasi po nag-head po siya ng Employees Compensation Commission and parang masasagot niya yung mga tanong niyo when it comes to EC claims or employee compensation claims po. So, may I ask our tech team to take a screenshot of the panels of our participants? Just
Ayan, 1, 2, 3, smile na lang po. Ayan, so madaming slides po to. Ayan, so ayan, mga 1 minute lang po tayo mag-smile. Ayan, so next po na ano natin. Okay, next pa po. And so madami po kasing participants. And, okay, last one po. Smile pa rin po. Ayan, thank you so much po. Okay na po.
Thank you for that, Ms. Mao and Sir Jomar again. Thank you. So I guess we are at the juncture that everyone has been waiting for. Hold on to your scanners, to your keyboards, and ready to type in the link of our evaluation form for your certificates. So no evaluation, no certificate. We will only accept answered evaluation forms until 2 p.m. today, November 7, 2023. On behalf of the Occupational Safety and Health Center, this has been Paul Martin P. Jacinto of TPID, now signing off. Thank you.
OSH, 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 kampiyon ka. OSH, 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 kampiyon ka. Ako'y isang manggagawa, buhay at lakas ng industriya. OSHC ay sandigan, upang bayan ay mapaglingkuran. Anumang sakit di handa at alerto, ligtas sa sakit at kapahamakan. Safety first ang kailangan. Anumang sakit di makakapigil, sa sakunay di pasisigil. Dahil OSH kampiyon ako, iwas ako na sa trabaho. OSH kampiyon ako,
Once again, we would like to thank everyone who participated in our webinar this morning. We will now end the Facebook Live and close the Zoom virtual room. Thank you.